We have a keynote lecture, and this lecture will be delivered by Professor Dr. Zabta Khan Shanwari, Vice Chancellor, Federal Urdu University of Arts, Sciences and Technology, Islamabad, and Fellow Pakistan Academy of Sciences. Lecture is on the traditional medicine in Pakistan.
Bismillahirrahmanirrahim. Thank you very much. I'm really grateful for the honor that I'm here. Thanks to Professor, my dear brother Iqbal Chaudhry, Coordinator General Comstech. We are working since last century. I'm not saying he's that old, but we are together, brothers, and always I'm inspired by his work and guidance. And we have flourished both in a way, learning specifically from him to me. One-sided learning. Thank you, sir. And then we have Raza Shah. We have Chinese good delegations with us. I'm really grateful that you are visiting Pakistan. My presentation mainly focuses what next? What should we do? Specifically when we talk about traditional medicine, both in Pakistan and China. And for your ease, I have tried to put some Chinese translation on all slides so that if I speak fast, you could understand what I want to speak. Next, shall I do it myself or I hope I can work. I should not be talking more about herbal medicine. I remain president of National Herb Council. We have, we call it National Council for TIB, and that's the government body. We were trying to promote it, but so far there are a lot of hurdles in it, and today but when we talk about globally, of course, there are a lot of benefits of herbal medicine, traditional medicine, both China, Kampo is in Japan, I remain there, and then Veda, etc., etc. So there are a lot of things. But the problem, that challenges that we have, we should be understanding drug-drug interaction. Sometimes, we have to have some evidence-based things in this medicine. That's what we are trying. That's what we are doing. And understanding of the regulations in the country. That is another thing. And the side effect, if any, people say there is no side effect. There is. When you have different kind of, things without an expert, self-treatment may cause you a problem. For example, if you are using ginger or garlic and the next day you are having teeth cleaning, you will be in trouble because your blood is thinner and that will bleed and will never stop. So that's, for example, a very simple thing. So this is what we all need. And the third thing, we do in haste, like we use a lot of antibiotics from the childhood to get quickly, the health. That problems, and now antibiotic resistance is the biggest problem in the world that we are facing. And in this case, it is slower in healing, but surely it heals you with no that kind of effect that we are having long standing for hundreds of years. Now, in Pakistan, when we say the problem is silo of academia, forget about ICCBS, that is the best institute in the world. And thanks to Iqbal Chaudhry Sahab, Ataur Rahman, and Raza Shah now sitting, they have made it. That's an island in the country. I'm sorry to use these words, but that's the truth. That is there. But otherwise, if you talk about the whole country, there is a silo. And the problem is, when we talk about this triple helix, we talk a lot. We say to the policymaker, and that's the job of the academy. We should accountable ourselves. I remain Secretary General. We should accountable ourselves what strides we have made in the policy, linking academia with industry. And if we talk about that, the job I should not be talking tomorrow when I was coming, the Secretary General was saying, be quick. So I thought I should finish in a minute, but that's not possible. I'm sorry, sir. I will take 20 minutes, which I was told. So the triple helix university doesn't provide only graduates. It should provide innovation. That is our job. That's what we should be doing. And industry doesn't provide only jobs. it provides problems and funding. They should provide problem to the academia and give some funding so that we resolve those problems, innovation in the, universities. And third, the government doesn't provide oversight, only it provides the policy infrastructure. Anything here? I'm sorry. Yeah, thank you. And when these are all, we work together, it works. But traditionally, the last paragraph, our universities have been ivory towers. And in many developing countries, not only in Pakistan, I represent OIC countries in a way where it's the same as Iqbal Chaudhry is doing a lot. And we had several meetings that we were working together. I, as a vice president of Islamic World Academy of Sciences, that we should be doing things like there. We produce 600, 800 publications of impact factor Q1, 2, 3, 4 in the universities. But next, there is a silence. Then only ICCBS or those kind of are in silo. So the problem I simplify is the silo effect that we have to address. And today I will be telling you more about for bioeconomy with the Chinese friends that we should be focusing on. So now bioeconomy. If you look at the indigenous flora, I will be telling you the importance of Pakistan and China in terms of indigenous flora and traditional knowledge. If you look at the lens of modern science using nanotechnology, my labs in Qaid-e-Azam University, ICCBS, we are all doing that. And if we use that, that is that we could be really doing globally. We can take our share. I will be telling you the global business of, nutraceuticals and traditional medicine that we have. So we can take our shares from the globe. For my friends in Chinese, I have translated a bit of it. You can just go through that paragraph over there. I give you one example only, the cancer, because Pakistan is really in terrible state. And I will take one case only, breast cancer, because my lab is working on breast cancer. And we have done significant strides in breast cancer. We have identified, sir, we identified one plant. You say accidentally that UK people were doing something, put a plant from Karachi, keeping it simple, take it to UK, they work, they publish it. Oh, there is a fungus within the plant that, stops cancer, breast cancer in the woman. But the name they gave was wrong. Scientifically, I'm a taxonomist. So then we act together, and finally, my lab is also working on nanotechnology, etc., the business, and we are finding solution to it. We have patents also now. Dr. Ali is sitting with me, and we are very close to have some products too on that. So, but when we look at these figures, really a problem. We have done some good things in 2022 to 2026, 5 years in Pakistan, but still 16,000 cases are reported every year minimum. And 44 deaths every day in Pakistan because of breast cancer, despite of all the progress that we have made. So we need alternate things. And this is now hearsay, but I gave this plant to one of the vice chancellor. I'm vice chancellor, my colleague vice chancellor. His mother-in-law, the hospital said, take it her home, only few days left. And believe me, it may be miracle, but they are using that plant, sir, and she survived for 3 more years. So that is that there is something good in the nature that you have to work for it. So here is the in the bottom some data about the cancer in the country of different cancer that we have. But when we talk about this, plants, in the globally around 70,000 plants are used somehow in traditional medicine globally. That was for different kinds of things. But historically, 60,000 years ago in the graves, we found medicinal plants in Iraq and other countries that people were putting with the graves, that when they woke up, if he has a throat infection, what he will use or she will use. And if she has this was the myth at that time, no writing, nothing. They were living in jungle. They were, nomads, but they were doing this. All information is now available globally. For cancer alone, 3,000 species are reported somehow that they are helping. But we, as a scientist, we have to work for it to develop those kind of things. And this is only about the higher plant, but if you look at the microorganisms like algae, fungi, lichens, sponges, many things that can help you. So it's the you that you are. This is that plant that I was talking about. In our local language, we call it damasa, figonia. That really works a lot, not only for cancer, but if you look at the list on the other side, on the red side, I mean, when I was a small child, they were putting on the, near a well where it's cool. Those days, no refrigerator. They were cooling it at night. In the morning, they were giving us a small spoon and no irritation, no things. It was cleaning, the blood. And it's still that hepatitis or different kind of things. It's being used in many countries for different things. In my country, different, but in other countries, all this list, I found it from Google, that in which country for which this plant is used. So it's a sort of a miracle plant. But when I compare, we love to compare ourselves with India. But if you look at this, there is an independent ministry, AYUSH, for traditional medicine. In Pakistan, believe me, we are really struggling to have a policy. But in there, Ayurveda, Yoga, Unani, Siddha, homeopathy, and for 1 year budget only, I put this budget around, 39, I think, billion, more than 39 billion rupees, Indian rupees, for this ministry, for these development of theirs. So that is what they do in our country. I shouldn't. So this is what we now work together with you guys, Chinese and our leadership, Iqbal Chaudhry, Raza Shah, etc. We can really find something good for both the countries. It will be win and win. So this is what I put it here, the breakdown of, Unanis and Pakistani, Muslim kind of, traditional medicine. Rest is totally focused to Indian subcontinent. So this is how they use the things. Now coming to Pakistan, very quickly, I love to say this sentence, that Pakistan is the only country in the world that stretches altitudinally from 0 meter to 8,611 meter. That is the different latitudinal things that we have, altitudinal things that we have. China is very good, the next one with us. We are having these two countries, if we join together, we have every kind of flora available in these two countries because of this diversity that we have, both diversity in humankind, in animal, and in plants. And that serves a lot if you look at it. There is an Everest in Nepal, you may have a question, but they have only mountains in that region. They wish to have a seaside like we have in Karachi, beautiful Sindh, and beautiful Balochistan. They wish to have that. We have it. But I use the word in Urdu, nalaik, that we couldn't get benefit out of it. I don't want to say that's ghair parlimani lafz, so maybe my Secretary General will push me down. So that's why I'm, Now, if you look at the historically very quickly, it's not of today. When you say alternate, they say, traditional medicine is alternate. We don't agree scientifically because allopathy has a history of 250 years only. And this is the history of traditional medicine. So which one is alternate? I don't know. In English, the word you may say better. But even if alternate, then when I say Pakistan, believe me, we have every kind of caves available. We had seals in Harappa 6,000-7,000 years ago. There are seals that they say this is for this medicine. This is for that issue. And just a half an hour drive from here, Taxila, we had a very good university 2,000 years ago when they were treating with herbs the patients. Just you can go there if you have time. So, sir, the issues we work together for this. We have to work on safety, efficacy, quality, use, claims, etc. And for this, we should work with the government of Pakistan, and we are working with it. Iqbal Chaudhry has good connection, and the Minister of Health really respects him a lot. Now I'm also Karachiite in a way that I stay with him. So we are working together, and we are trying to resolve these issues to quality, toxicology, pharmacology. All this we are working together, and a good example is ICGBS, there we are together. Now, one more thing. Pakistan, we had problems for the quality assurance of raw herb. Now we are working, my friend who is sitting here, and Professor Hong, we are working with a company here, sir, and my lab is doing DNA barcodes that we can identify exactly which plant is what. Earlier, you were getting from the shop, pansari we call it. We didn't know there was a lot of mix in it because this is collected mainly in the mountains by small children and women. And then it comes down to the town. So now we are working on this, and you can make sure that the plant you are using is exactly what you want to use. And the technology is very quick. Even in the next 2 years, you will be having a portable kind of sequencer in your pocket like your mobile, and you can identify even in the field, the plant, what is it. So that is the technology that in future is coming up, and we will be inshallah using it. So this is that what very simple DNA barcoding that my kids are doing. Ali is sitting here, he's looking after the labs, not only for plants, but for viruses. We are having with Wuhan University on the different viruses, specifically of bats origin viruses, and we are having a very good partnership there. A little bit about why we should be doing all this. The global business, not that people are not going towards it. Globally, it's a lot of demand of the nutraceutical, for example, $451 billion US 5 years ago. And it is going to be expecting next 2 years, $753 billion US because of the growth rate around 9 to 10% every year that the demand is there. Because people are tired of using chemicals, they are going towards herbs. And that's what we really should be catching up, Chinese and Pakistani friends together. We can have, products for the globe to use it. So finally the recommendation for this, we are working, Professor Hong and ourselves, Professor Iqbal Chaudhry, we need your support. We want to you have a very good institute in the south in Karachi, doing all clinical, etc. We would love to we had one institute now in Qaeda-e-Azam University because of Academy's effort, very frankly speaking. We had a Belt and Road Initiative project. We started this from the Academy's platform with ANSO and Chinese Academy of Sciences. We got it. Now we should have another one in your project, Professor Hong, to have a traditional medical institute, you may name it, in Pakistan. And then we can work all this from what we call it from bench to bed. We should have product, having clinical trials with you. We should be having all this. So we are proposing this. We are having all the feasibility in place. We have submitted these kind of things, and hopefully we will get support from both the government to have that institute. The next one in the next 5 years, we should have it in Pakistan. The way ahead, let's integrate. Let's integrate whatever knowledge is available for the betterment of humankind. Whether it's a traditional Chinese medicine, whether it's a Pakistani Unani, and whether it's allopathy, but science-based, evidence-based. Let's do it. Potential synergy and optimizing the treatment outcome for this. We should be having evidence-based validating traditional medicine. We should be we should try to fill the gaps wherever they are between the patient and the medicine. And of course, for that, we need collaboration. And the best partner, Pakistanis and Chinese. That's a big hand to work, both of us together, to find this gap, to bridge the gap and have some good things out of it. And for other side, what we will be doing, academies of the world, Pakistan Academy, Islamic Academy, or Chinese Academy, that we should have enhanced public trust on us, on science. We should be trying to have everything evidence-based so that they have trust on us, and then we will be recognized globally if we do all this. And we will have, in our language, we say, Hum khurma, hum sawab. I don't know English, sir, leave it at you because you're the best brain sitting here. So that's up to you to translate when you come here next time. So, sir, for that, there is a regulatory things. I am a member of DRAP, Drug Regulatory Authority of Pakistan, sir. I'm sitting there on a traditional herb system, evaluating herbs and approving or disapproving. So there, we have identified all the issues there. We know the government system in Pakistan, and we can push it and we can help you out, the Chinese friend, and I will be showing you a couple of slides what we are doing here. These are all the government rules for different kind of thing for clinical trial like. ICCBS is doing something on Chinese traditional medicine. sir, we will be trying to have a Pakistani medicine to expose to clinical trial. And the best industry in the country, I remain CEO of that industry, Karshi industry, they name it, and they want me to request you to put any resources you need to expose, because WHO has one claim that no Pakistani medicine so far is registered as clinical trial approved medicine. I don't know, right or wrong. Because when I'm in their meeting, they say that you need to do some. And for that, there is a section in draft, and they say the first two steps are okay for you because it is already traditional, thousands of years of knowledge, etc., etc. You don't need animal, and you don't need the second, and the third and fourth phase you need it, so that we can talk to each other to have it. So the other potential, very quickly, last one, sir, I'm trying to finish it in quick. Essential oils, the market growth, and Pakistani, specifically dry temperate region, is very rich to have some very good essential oil selling plants. It stretches from Quetta to, Gilgit-Baltistan, all these Karakoram and Hindu Kush Himalayan, ranges. They have those plants, and you can have billions of dollar business if you want to do it. So there's one issue. Second, herbal extract, not doing a lot of, sending only plants. We are the top 8 countries selling our raw plants outside, getting peanuts. So that is what we should be exposing it to the medicine, value addition, and at least at extracts, 1 or 2, 3 companies are doing it, but we should be promoting it more. Then natural cosmetics, it's another business. Globally, this is a multi-billion-dollar business. Shampoos, creams. They when you look at the TV, they say this toothpaste has that plant. Actually, how much and how long? So this is another business that we can all work for natural cosmetics, both the Chinese friends and Pakistani scientists and industry. We can work together to have that one. So the growth drivers for all this, that why people want herbal kind of thing, because concerns about chemicals, reactions, climate change, temperature is changing, and this chemical have more problem for you. Maybe 50% of you feel rash, some kind of rashes every day. And this is because of all this, whatever is happening globally. So, and one of the things is the soap that you are using. I worked on this. That has a problem for your skin too. It does cleaning you well. You may have some good smell, etc., imported, etc., but you need herbal kind of soap even to use for yourself. And then social media influence. People are now talking about all this. Sustainability, we have to work together, and market expansion, that we can think about it. Just a very simple, my lab is doing this, so I propose 2 things. Immediate future, we can have some cosmetics, nanoscience-based herbal medicine, products. This is the short term we can do with all these people sitting here. You have all the expertise with you. And for the long term, novel drug delivery system, fifth generation medicine, what we call it, targeted through nanomaterial, for example. We are working on it. There are some issues because heavy metals are used on skin. We have already, sir, registered a patent for skin product. We cannot take it orally because of the heavy metal. It is in the nanotechnology business that we do. So that is a question mark at WHO. I'm a member of WHO advisory group on this side. So we can really work on this. And the previous one, which I was trying, but anyway, I can't go back. Karshi also is starting doing all this. Here, this I want to talk about my friend companies, Karakoram Biotech Company in China. We have worked together. In China, 29 Pakistani species are registered that can be imported there, subject to certain tests. We are already working on this, that my group friends are sitting here. I took their permission to talk about this story. These are the plants, I put some name, not all. They're very famous plants. Some are very easy, sir. It's a weed everywhere. You can just pick it because we really are tired of having all this in the streets. And some we can encourage the farmers. They will get more money than wheat and rice and everything if we try to domesticate it and have a purchaser there. So they will get some more money, and you will get ideal product with the equal distribution of chemicals, etc. I'm not having time so to talk about how can we ensure the best quality through cultivation. So that's what we really are looking at. This is that company that you are there. We are now working with them, helping them to out, and we are trying to register some more, 29 species out of 6,000 Pakistani species that we have. Is really too less. So we are working with the Bharat government, Pakistani sir, we need Iqbal Chaudhry Saab's intervention with the minister, that if they could talk to the Chinese partner also, that this list should be expanded. This will help the farmers to get more money through cultivation of certain more. These are some of the examples. I put only few. We are already in a process of proposing some good medicinal plants that are needed in China. They are a traditional medicine system based on these plants. So we are working with the government. Since last 1 month, we had several meetings, and hopefully we will get it for China for the betterment. I usually go to China because I'm the advisor of ANSO, international advisor, not because of academy, but my own, I'm on their board. So when I went there, gynae ward, other ward, all traditional kind of medicine system. In Pakistan, we need to really promote such kind of things. At least to the basic diseases that we have with the child, with the basic health care, we should really be working to promote all this. So, way forward, finally, what should we be doing? Import-export collaboration. Let's this group that is in Pakistan, I have put it again for you in Chinese. What I want to say, that let's work together. And you, sir, have the umbrella, and we will be beneath you. You can save us from the rain. The rain, I mean the bureaucracy and the COVID that is in between. And then we can have some more symposium, sir, under your umbrella, in Comstack or in academy or in my university. I'm a servant of a university quite big in Karachi also, in Islamabad also. So, sir, we are ready. Our all things are at your disposal. Let's have another symposium with a targeted business ideas, not only having technical scientific papers. I'm sorry, I'm tired of it. Let's do business. And then technical services, I already put ICCBS, Qaid-e-Azam University, FUAS, and there is a Karshi industry, Hamdard industry, many industry, nationalist industry. Let's work with them. And as I told you about already, traditional medicine institute that I am talking about, what you call it, I put it named TIMRI, Traditional Medicine Research Institute. This is both Chinese and Pakistani. We share knowledge with each other, and we could have some product for globally. I already had a meeting with Likshin was here, and we are trying to have some, fruit product, etc. And for that, we should have a regulatory and ethical governance system. I will work with DRAP. I'm already there. But we can have ethical review committees all the time too. The only target is to benefit humanity, no harm to humanity. That should be our sort of a religion, that we will work for the humanity. Thank you. And for that, good clinical, practical implementation. Raza has already a lot of experience on it. We could benefit from you, sir, and we could have this in here. And for that, the target areas are very, very briefly, that we can, the discovery, research and development we're already doing. Preclinical already system is available. And then standardization of herbal medicine, quality control and assurance of the system. When I say clinical trial, I told you already Pakistan has exempted the basic 2 steps for you. And we can have pharmacovigilance and evidence-based validation of Unani and traditional Chinese medicine claims. We can have all this, and that will promote your business. I'm sorry, I think if you want to raise a hand, I don't know whether it permits or not, but I'm really for natural medicine, for sustainability developed in Pakistan and China. This is my motto. This is what we should be doing. And a word of thanks. I thought President of Academy would be here, but he's not. But the Secretary General is here. And thanks to Professor Leo to be here, and all the delegates, Iqbal Chaudhry, for moderating, crucial collaborators. Because of you, we are here. So we are really grateful to you for having this foundation stone that you're keeping it for the business that I wish we would be getting in, inshallah, in future. and all other friends, and take home messages that let's harness the traditional medicine for modern medicine and nutrition system. And this collaboration between China and Pakistan will open doors for future health. Synergy between our academies, Chinese, Pakistani academy, will shape the future of not only Pakistan and China, but globally of the humankind. Thank you, ladies and gentlemen. And I request Professor Iqbal Chaudhary to kindly hand over a small souvenir from this is my university where I am a, what you call it, a salesman. Take something if you don't mind, just for you to take.
We another gift for Professor Liu, and Professor Aslam Beg and Professor Iqbal Chaudhary will present. There is another gift. Professor Liu, another gift please for you.